I was diagnosed with diffuse gastric cancer, unfortunately April last year. Started with some problems with my kidneys, so I didn't really know it was my stomach, because one of the problems with stomach cancer is it doesn't tend to give you very much symptoms until things are quite advanced, and that was the case with me really. It's been difficult, there's no two ways about that. Sandwell's been dealing with me as far as seeing the consultants and seeing the CNS nurses, and they probably don't realise this, but they helped me from the very outset of this. When I had my endoscopy, so I had my endoscopy on the Saturday morning, and I knew that I wasn't well. I hadn't been well like for months really, because as I say, I'd got ongoing problems with the kidneys, and the doctor there told me that he was pretty certain that I had got stomach cancer. And on Monday morning I had a phone call from Joe saying to me, you know, you went for your endoscopy, how are you feeling? What did they tell you? And then she said to me, and then she was practical, so what she said to me is, have you lost weight? And I said, yeah, I can't eat anything. And she says, well, what are you doing about that? And I said, well, there's nothing I can do, I can't eat, you know. And she said, well, you need to sort yourself out, and you need to see food as medicine. And she said, I want, you know, have you got somebody that can come down to the hospital? And my husband came straight down and got some build-ups and things. And she gave me that little bit of positivity to get out of bed, and what she said to me was, now when you see the consultant, you know, if you've got to have any treatments, you know, you need to be strong, you need to get your weight back up, you need to get this. And so I did. And it was Joe actually, so it was the CNS who actually gave me my diagnosis as well, which personally I found good. She read the room, so she didn't rush and tell me everything straight away. What she did was she told me that it was cancer. She was very clear about that, but then really allowed me time to just ask any questions, and only told me what I asked, which again I reflect back on, and I think that was the right thing for me personally to do. Well, they've just made a really bad situation easier, just easier. And every single time I have had a concern, however small that concern is, I have been able to message one of them. They've answered me straight away. If one of them's not available, one of the other girls will answer me. And I haven't felt alone. And I haven't felt so afraid. Because it's scary. But the worst thing is that fear that nobody's going to answer you, or you're going to be on your own, or you're not going to know what to do. And I've never felt that. I've never felt that. And that's been really good for me. And my journey's not over yet, but I still know that they'll be there. Has been a godsend to me. A godsend. It really has. And I can't speak highly enough about them. Yes, they need to be recognised, and I think patients need to know that they are there and what an excellent resource that they are, because I've had very good doctors and a very good oncologist, but ultimately the nurses have been the mainstay for me. They really have been the mainstay, and they really do need a day for them to shine really, and for people to know what they're doing and the good job that they are doing, the excellent job that they are doing. Yeah.